Hi, Dr. Peter Ahlering here. I'm the medical director of MCRM Fertility in St. Louis and Tulsa. Today, the tip of the day, so to speak, is regarding what to do for fertility evaluation. So my advice is always get the simple but thorough evaluation as quickly as possible if you're suffering from fertility issues. That would include on the female side a simple ultrasound to look at something called the antral follicle count and an AMH. Those are sort of the basics, and most important to understand what is the ovarian reserve. That is critical. It's like an egg count on the female side. On the male side, doing a detailed semen analysis, which would include the assessment of morphology as well as DNA fragmentation. Those are qualitative assessments as opposed to the typical quantitative assessments that people typically get, count, motility, and things like that. But additionally, the qualitative assessment is, I think, just critical because it can look for abnormalities that are otherwise undetected on the traditional semen analysis. So that's the basic evaluation. Now, when to get the evaluation? In women under the age of 35, if you have regular menstrual cycles, then perhaps waiting in that neighborhood of 10 to 12 months before seeking evaluation is reasonable. Now, the problem that I see comes in with what is a regular menstrual cycle. Regular menstrual cycles are 28 days plus or minus a day, and anything other than that would be considered somewhat irregular, in my opinion. And the importance is that ovulation dysfunction can occur when the menstrual cycles vary more than a day from 28. And a positive predictor kit doesn't necessarily mean that ovulation is normal. It may mean that ovulation is occurring, but it doesn't indicate that ovulation is necessarily normal. That's important to distinguish. So women over the age of 35 that have regular menstrual cycles may want to seek evaluation perhaps a little bit sooner than 10 or 12 months of infertility, maybe more on the 6 or 7 or 8 month time frame, to look at those basic things with the male and female evaluation that I mentioned earlier, because they're more likely to find things like diminished ovarian reserve in women over the age of 35. However, under age 35, in our experience, it's not that uncommon to see diminished ovarian reserve. That said, hopefully this is a helpful tip of the day and hopefully helpful information for you in your fertility journey.